Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 460,743 confirmed cases of COVID-19 in Canada and 140,181 cases in Ontario. Chatham-Kent has 543 cases and Sarnia-Lambton has reported 447 cases. Michigan now has 430,780 cases, with 23,096 cases being in Detroit. Today we are reporting 195 new cases of COVID-19 in Windsor and Essex County. As we are dealing with all of these cases, we do not have the breakdown of all of the cases. We have had 4,763 cases since March, 3,893 cases are now resolved, and 779 cases are active and being followed by our health unit. 53 confirmed cases are currently in the hospital and 11 people are in ICU. In Windsor, there are 60 suspected cases of COVID-19 currently in the hospital as well. We are reporting 5 deaths that occurred over the weekend, all from the community. 2 people in their 70s, a man and a woman, passed away, 1 man in his 80s, and 1 woman in her 90s. 4 people had underlying health conditions. Our community has lost 91 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 21 active outbreaks in Windsor and Essex County. 7 long-term care and retirement homes, 9 workplaces, 2 community outbreaks, 1 hospital, and 2 schools. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your close contacts to your household, the people that you live with. Keep a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering outdoors if physical distancing cannot be maintained, or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands, and cover your mouth and nose with a tissue, or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 3 testing and assessment centers: Windsor Regional Hospital, Olet Campus, Windsor Regional Hospital, Met Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Today, Windsor and Essex County formally moved into the gray lockdown zone by the province, and today we are also reporting a record number of cases in the region. We hope that with the lockdown measures, people will follow the public health guidance and prevent any further spread of COVID-19 in our community. There are significant changes in the gray lockdown level, and I want to highlight some of these key changes. The gray lockdown level include all measures from previous levels, plus it also asks for no indoor organized public events and social gatherings except with members of the same household. Limit of 10 people for outdoor organized public events and social gatherings. Wedding services, funeral services, and other religious services, rites, or ceremonies limited to 10 people indoors or 10 people outdoors with physical distancing maintained. All indoor and outdoor dining services are closed and they are open only for takeout, drive-through, and delivery. Facilities for indoor or outdoor sports and recreational fitness are closed with some exceptions. Outdoor recreational amenities such as outdoor ice rinks, trails remain open with restriction, for example, no team sports played. Meeting and event space closed with limited exceptions. Non-essential retail open only for curbside pickup delivery only, that is in-person retail shopping not permitted. There are several exceptions that apply. Businesses that fall under the exceptions are permitted for in-person shopping at 50% capacity. Locally, we will monitor the capacity limit and may put additional restrictions to limit the number of people in the store to allow for physical distancing and allow for limited gathering of people. Personal services settings are closed, for example, hair and barber salon, nail salons. The person responsible for businesses that is permitted to be open must prepare a safety plan and make it available upon request. In addition, I want to address 3 important points today. I have noticed that there is a lack of understanding about the pandemic response, especially what is the role of your local public health unit and what is the role of other partners, including our healthcare partners, politicians, and the provincial role in setting out these restrictions. Starting off with number 1, schools. Based on the local epidemiology, number of active cases in the community, number of cohorts dismissed, and the ongoing concerns with community transmission in Windsor-Essex, I issued a Section 22 order under the Health Protection and Promotion Act to add an extra layer of protection for our children to require online instructions until December 18. The Windsor-Essex County Health Unit truly understands the importance of in-person learning, and that is why we have always advocated for and supported opening the school. And in fact, Windsor-Essex County Health Unit worked really hard to develop the school toolkit. And I want to take this opportunity to remind our residents that Windsor-Essex County Health Unit developed our toolkit ahead of any provincial guidelines because we cared about our children, and our local schools wanted everyone to be prepared when the schools open. And I want to assure you that our health unit, despite being one of the lowest funded health units in the province, is strong enough to produce many guidance documents, took steps in the right direction before any other jurisdiction in the province of Ontario. We know many jurisdictions followed the footstep of Windsor-Essex County Health Unit to implement measures that we put in place first. Our recommendations for schools changed based on the local epidemiology with the key purpose of protecting our children. We will continue to provide our recommendation based on our local epidemiology. Number 2, big businesses versus small business and the issue of fairness. I'll start off by saying that there is no local recommendation or guidance to allow which businesses can stay open and which businesses should close. This is a provincial framework, and local public health unit have no input in what stays closed and what stays open. I'm sure our local politicians already know that information, but I want to be absolutely clear, and I don't want anyone to start pointing fingers and to create an impression that local public health unit is responsible for shutting down the small businesses. We are not. Any concerns about these businesses should be approached properly through political channel, and local public health should not be blamed for it. Number 3, closure and impact on mental health. Public health understands the impact of pandemic on the mental well-being of everyone. There are a number of mental health concerns being identified in young children, young adults, seniors, and everyone else. I want to make sure that we all understand that we all have our roles identified. There are agencies that take lead on the mental health issues in the region, and I'm sure that they are fulfilling their responsibilities based on the expertise they have to address these concerns. Public health will continue to do health assessments of the community, share information, and work with our partners to address these gaps. But I want to be clear for our community that appropriate mental health related questions should be directed to the agencies that are responsible for addressing the mental health concerns in our community. Thank you.
We'll now take questions from the media. Today, we'll start with AM 800.
Dr. Ahmed, in regards to the schools, with the provincial lockdown in place until the 11th of January, obviously your order goes into place until this coming Friday, then the kids are off for 2 weeks. Have you considered extending the order until the 11th when the lockdown is set, and I know it could change, but is set to expire?
Well, we are looking into all of these options, and as I said, some of our actions trigger other conversations at different levels, and there are a number of conversations that are happening at the provincial level and in some of the other health units as well, to look at developing some matrix, some criteria to assess the risk for our community. There are some criteria that are already put forward by CDC and some of the other places to identify the risk of transmission in these schools. And by any measures any matrix when you have this high level of community transmission and this high number of active cases in the community. It puts anything that's open at a high risk, whether we are talking about essential businesses, whether we are talking about any essential workplaces, long-term care home, retirement home, hospitals, everyone, the risk is increased. So in similar analogy, despite the importance of having in-person school learning, the risk in the school setting also increases. So it's all about adding those layers of protection, and in thinking about those layers of protection, we will be looking at our data. It would be great that if there is any kind of provincial framework that comes down that help us to be consistent everywhere, but knowing our local epidemiology, we took that step. And if we get to the timeline in January, and if the community cases, community transmission continues to be at that higher level, which puts everyone at risk, including our schools, we may make that decision, but it would be too premature to say what that situation looked like. But we will be monitoring those data. We will be having those conversations internally, as well as with our colleagues in the province, to make sure that we are all doing it right.
I believe kids go back to school on January 4th, so you would hope to have that decision made, I'm guessing maybe a few days prior to that. Is that safe to say?
Absolutely, because I think we do need the school boards to be on board. We also need to have some of the dialogue going on with the provincial ministries, the appropriate Ministry of Health, Ministry of Education, so that they are aware of the situation in Windsor-Essex and any local changes or local order that they need to be aware of. So we probably will make those decisions at least a few days in advance of children returning to school.
And then the 195 cases today, these cases, were we still in the orange zone or the tail end of the orange zone, or are these cases that we were in the red zone? Is it tough to identify when these cases, I guess, when they were confirmed cases, or the index case, I guess?
Well, we do try to put our epi curve by setting some timelines in terms of their symptom onset date. And that allows us to understand if someone is starting to show symptom today, let's say, almost 50% of them generally show up symptoms within 4 to 6 days of exposure. So if I was exposed to 4 to 6 days ago with a confirmed case of COVID, and if I'm developing symptoms today, that exposure would be linked to that. So whatever we are seeing, again, there may be some delays in testing, but I don't think that what we are seeing is from orange. It's definitely from red, and it's more recent. I would even go to say that most of these cases should be from last week when they had the exposure, or maybe a few days before the last week. So everything what we are reporting today, it's I want to say, based on what I know locally, is 90% of them should be from last week, and not more.
Okay, thank you.
Any questions from CTV?
Yes, good morning. Malls and stores were packed over the weekend. Are you concerned that this could drive up the case counts even more over the next few weeks?
Well, that is the concern, and I think it's. I will say I'm honestly disappointed by the number of people that were out and about over the weekend. We have worked really hard to get the message out about the cases, about the potential impacts, and about the restrictions. I think there is no doubt in anyone's mind that if people were not expecting that this is a surprise, that lockdown came in. So I'm truly disappointed to see that people took this opportunity and just throw everyone out of the window just to get to what they need to. There are a number of ways to do it safely. I do worry that it may drive the number, but we'll see. There were people who were following the public health guidelines, but still, just the number of people coming together in large numbers, it increases the risk significantly. So we'll have to wait and see what happens, but I hope that we don't see the numbers. That's my hope, but we'll have to wait and see what happens in the next couple of weeks.
And now that we are in lockdown, are you concerned that the lockdown measures won't be as effective because of COVID fatigue, and people are just tired of following the rules and even more restrictions?
Well, I think those are two different issues. I think the lockdown measures, basically it gives little opportunity for people to go out to do something. Obviously, the restrictions on the social gatherings are a challenge, and what we have heard from our law enforcement agencies as we are all concerned about that too, and there will be more proactive approach to this issue, and we'll try to get in control in the best possible way. But at the end of the day, it goes back to, if as a resident of Windsor-Essex, whether I am willing to follow these measures or not. Because if I am not, doesn't matter what we try to do, we will never get to where we want to, because practically it will be impossible for all this is combined everyone, all the public health bylaws, police, everyone, to enforce it at everywhere. It's not possible. So I think we need to understand what are the risks that we are putting ourselves into, and what kind of risk we will put others people. And I've always said that, as a community, we do have a responsibility, and we have seen, and the numbers are there. People are dying, and people will die. And I will repeat that again. Based on the data that we have, and even with the most conservative estimate, if we are talking about 2% to 2.5% of fatality that we have seen in the region, that means for every 1,000 cases, we're talking about 20 to 25 people dying. So you can do the maths, and that means 20 to 25 families that are impacted by it, and then the extended families that would be impacted by it. And as a community, are we okay to say that it's okay, let people die, we'll just still do what we need to do because we are doing it safely? No, you're not. Because if people must be doing these things safely, we wouldn't have this number of cases. So it's a false sense of security that some people are putting forward. And I'm not a believer of conspiracy theorists, but I do feel that there are messages that are out there intentionally to confuse people, to give them this impression that this is all not working out, and they are the one pushing forward it, and they're pushing people to do things which would put everyone at risk. And I'm really concerned about that, and I keep repeating that people, at least, and even when I hear that, majority of us are following, but what happened over the weekend with the number of people that are out, what are they thinking? Are they not thinking that this is something that would put everyone at risk, themselves at risk? So I do feel that those are all separate issues, but just having those lockdown measures with strong restrictions, I really hope that there will be very limited thing for people to do, and then the indoor environment, the social gathering inside their home, that will be the area that we need to get a real handle on, and to prevent that from happening, because truly our healthcare system, our community should not lose anyone to COVID, and we must do everything to protect everyone.
And do we have an update on if there were more charges for non-compliance this weekend?
Not today. We didn't receive an update, but we'll share that update tomorrow when we get it from our team. And generally we get that, but I think weekend was busy for our case and contact management, and we don't have that number. We'll share that number tomorrow.
Okay, thank you.
Any questions from CBC?
Dr. Ahmed, I know we have not seen numbers this high in the region ever before, but whenever we have seen a spike in the past, at times these cases were traced back to farms. Currently, there are 4 outbreaks in that sector. Any idea how many cases are attached to those?
Well, you will see more cases attached to farms as well. We are seeing some. We have seen some cases over the weekend, and there are some pending investigation that's happening. That number is set to increase. I don't have an exact number, but I can say that there are many cases that are active, and there are many contacts that we are trying to follow up, and probably we'll try to see if we can provide that breakdown. But at this time, all I can say is the numbers that you're seeing on the website, it may increase today.
And I know last week, Dr. Ahmed, you had mentioned, I know you said it almost jokingly, but you had mentioned as a thought that, things are getting so bad, let's just shut the doors and just call it a day at this point at the health unit. Today, when you see this number of 195, a number so staggered, in terms of how high it is, can you speak to just how that affects operations and the stress that puts on the local health unit, particularly because we were talking last week about, 3 straight days of triple-digit cases, and now we've seen this number that's, higher than we've ever seen before. What kind of stress does that put on your team there?
Well, I think you probably heard some of that stress in my tone today. It is really unbelievable number of cases that we are seeing. And the worst part is we've been very transparent, and I sit in front of the camera every day just to make sure that our community is up to date. We're not flying blind. We share the most up-to-date information that we have with our community. I am here to answer all the questions. Teresa is here to answer all the questions that the community might be thinking. Just to make sure that we are being transparent, we are sharing all the information that we know. And when we see these type of numbers, it's I don't know, like I don't have the words to describe it, but it basically, it just brings us down, like, all the energy that we need to go ahead with the day and to figure out now 195 cases in a day, and each case investigation, if it's taking us at least 1 to 2 hours for one investigation, how many staff hours that it's taking us, what kind of resources that we need to put in place to maintain that. And on top of that, any of these are, when they're linked with outbreaks, it adds more stress and more concerns for us and for the community. It's been nonstop, and it's almost the thought comes every day, and we basically like to move forward with some positive thoughts. We got a lot of support from our community last week when they reached out to say thank you to our staff for doing all that work. That's the motivation that we have to continue to come to work and to do the thing that is needed in our community. But with the numbers that high, I don't know how we can continue to draw the energy that we are putting for our community to do all this work. It's been nonstop, and I truly hope that this is the last time that we are seeing this high number. And from this point onwards, I hope that it should only go in the direction which means less cases and low transmission in our community. So I really hope that, but it definitely impacts us deeply and adds a lot of stress and pressure, not only on us, but also on our staff.
Any questions from Blackburn?
Hi, good morning. I guess this morning you mentioned, you kind of laid out what was your responsibility and what was not, and you mentioned the closure of small businesses. That was a provincial mandate. I know there are some BIAs locally that are looking to put a petition together to have small businesses open. They are thinking that they have far less people in their stores than, say, a Walmart or a Zehrs, and they could do so safely. If it was your decision, is this something that you would agree with?
Well, I think let's just go back to what my role is and how we put everything into perspective. So if the issue we are talking about is a public health issue, and what kind of risk we are talking about, for me, the risk is people getting together. That is the risk. That is all I can justify putting any restrictions when people are coming together and what kind of risk it is posing. Whether they're coming together for a party, whether they're coming in for any essential reasons, whether they're going into school, whether they are doing anything, that is the concern, and what kind of mitigation measures we need to put forward. So when it comes to local businesses and what their ability is, this is not a public health responsibility. Even when we are talking about, it's a fairness issue, sure enough, but those are the issues that the politicians have to deal with and figure out a way what their political role and responsibility is when people are talking about these type of issues, because those are the domain and that's their expertise to think about the businesses, the different types of businesses, the scope of businesses, how businesses operate. That's not public health expertise. They have to figure it out. My expertise, my limitation is more on looking at the picture, looking at the risk that is associated with the activity that has a public health implications. Large number of people gathering, that's the risk. So that is my concern. And I don't even know that even if the petition, I don't even know who is being directed to, if it's coming to me, I think it doesn't serve anything at all. I think it has to go through the political channel to the people who have created these rules and regulations and putting out all these exceptions, what it stays open, what doesn't stay open. There's nothing that I can do, and I think we just need to be clear. I definitely don't want people to use health unit as an excuse for them or to shift the focus of discussion onto something which is not useful at all. If as a politician, if they feel that they cannot make that change or if they cannot do something, they need to connect with the right through their ranks and through their political channels to try and advocate for what they believe in. Talking to me or sending all these messages or redirecting people to us, it's not going to change anything. And it will just create more negativity in the community. And we definitely don't want that, because we need people to understand that what we are doing is public health, and what our role is, it's public health. And we want people to comply because we want them to comply because of public health. Everything else, I think they need to just look for the right agency, right responsible people, and then just channel their energy or channel their work through them to the right people.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. I can anticipate residents asking this question, so I'll do it for them. Are the 195 cases today, is that in any way attributed to a backlog in tests coming through all at once, or is this the typical number that you document from 4:30 yesterday and you report the next morning today?
No, I think we've changed the timeline of data pool, so it's no longer 4:30. It's later, and I know the data even came in late last night. What I can tell you in the 195, that there are at least around 15 to 20 cases that can be linked to some reporting issues that is lumped into 195. But even if you take those 20 out, still 175 is current. So there are some of the I guess extra reporting that we are doing today, but generally it's 175, which is still a lot for a single day for our region.
Is it still a roughly 24-hour period, even with the change in reporting time?
So I'll let Teresa answer that question, because we have been we're connecting with the labs, and labs are really feeling pressured as well. So I'll let Teresa answer.
So the labs are saying between 48 and 72 hours for a result to be processed, and then our staff are actually on the weekend. Obviously, with all of the increased cases, they did not reach everyone, so things are being carried over again. But we do have a group that are notifying the positives right away to give them initial instructions, pending that further in-depth interview from our nurses. But we are exploring getting outside help to address all of this. Even though it is overwhelming, we just need to act and make sure that we keep at it and do what we can. And what we can do is engage with outside agencies that have the ability to help us at this time, and that's what we're doing. And hope to get caught up, and hope people do their part too to slow the case counts and allow us that ability to catch up and give everyone that in-depth interview and decrease transmission.
Thank you for that. In terms of the 195 cases, is that still being taken from a 24-hour window of cases reported?
Yes, that's typically how it's reported. So other than the 20 cases that Dr. Ahmed spoke about, and we do know that many cases over the weekend are attributed to one particular long-term care home that's in an outbreak. There are some agri-farm workers and many household contacts of cases. But the exact breakdown, we don't have it this time, but we do know that there are many from some outbreaks that are occurring in our community right now.
And doctor, is it fair to say that you are mad today?
I can't be mad. I think I just it just sometime we hit our low when all we see is no respite for us, and I think as much as that we have got a significant support from our community, but there are still a significant number of people who are either not getting the message or not follow the message. I don't know what it is, but I truly hope that they get the right message through the right resource. And this is a global pandemic, and I cannot answer every question that many people may be asking. But sitting here and going through it many times throughout this entire pandemic, I think we have answered almost all of the question. And though for those who still think that these measures are too restrictive and people should not worry about look at what is happening everywhere. And I don't mean to paint any country in a negative manner, but when you're talking about this pandemic, you have lessons to learn. You can see which countries implemented what and then what the result is. So having said that, these measures are necessary. And even we don't have to go too far. We have to look at Alberta. Alberta, at the beginning, they did not put any restriction. They were not willing to close down many of the things that were supposed to be closed in pandemic. And their cases, what they're reporting today and how it's spreading, it's shocking. And so we don't even have to go too far. So until or if God forbid, if we are in a situation where it's completely, absolutely out of control, and then we are realizing, oh, let's go back and change it. We don't have that luxury. We have to act right now, and we have acted immediately when we have the data, when we have the evidence. And your local public health unit, and I will remind it again, we took steps much in advance of many other regions just to ensure the safety and well-being of our community. We live in a border town right next to a community that has 5 to 6 times high cases than ours. Their person positivity, their overall spread is much worse than ours. And despite all of that, we have done a great job in containing it. But the job is not over. And as frustrated at times I am, I cannot be mad. And I think we just need to think about the positive energy. And we try to bring that positivity, and I'm really a very positive person. Teresa can say to that. I like to put my trust in people, but we need your support. We need everyone's support to take us to a place when we start vaccinating people, and then you don't even have to hear anything from me. I'll just basically disappear. You don't have to follow anything that I'm saying once the pandemic is over, and then I will be living in my own peace. And I don't have to sit here or express my anger, frustration, or anything here. We'll just continue to put our head down just like we were doing before the pandemic, doing our job. Nobody knows about public health, and it's unfortunate that because of this pandemic, we're all in this thinking that we have I don't know where we are right now, but hopefully we'll move past that. So, but thank you for asking, Taylor.
Thank you, Doctor. Thank you, Teresa.
Any further questions from AM 800?
Dr. Ahmed or Teresa, is there any updates in regards to the third community cluster? Last week there was 32 confirmed cases. Has that number gone up at all?
Based on the number of cases that are coming in, we'll have to kind of defer that question for a little bit, because really the nurses that have worked on the weekend are just processing the cases and the interviews, so they won't be, you know, the EPIs that are connecting all of this. So we'll leave that to our EPI department and see if there's an update that we can provide.
Okay, thank you. And one final one here, kind of going off Melanie's question earlier about shopping this past weekend. Dr. Ahmed, with the holidays approaching, and obviously now we're in gray zone, you asked the community around Halloween, and I'm not even sure if we were in a stage or a zone, I forget, to be honest with you, about Halloween, not to get together, and people still got together on Halloween. Are you worried with Christmas about 2 weeks away and then New Year's, people are gonna ignore these orders and the cases will just skyrocket at the beginning of the new year?
Well, I think this is my hypothesis, that everything what we're seeing is probably the result of Halloween parties and everything that continues from that point onwards. And I do worry that there are people who are thinking about moving forward with their activities. I'm not sure if those are the same people who are trying to create this sense of panic in the community, or if these are real people who actually are planning to organize all of that. And I did talk about that it is a risky thing, and it not only puts you at risk, but also your loved ones at risk. We're talking about family, and I think at the same time we should think about our family too, that what is our role in keeping them safe. So this is the time that we all need to take precautions. We all need to spend time with the family and the people that you live with. Under the lockdown gray zone, it is very clear that no gathering with people who do not live with you at your same house. Their only exception for someone who lives alone, especially for this holiday season, that they can get together with one more family. That's it. And those are the exceptions. And I think people should be responsible that how they want to use that rather than abuse it. So all these restrictions are there for a reason, with some exceptions for really people when they need it. The exception should not be taken as a norm, and people should be responsible enough. And I truly hope, with the number of cases that we are seeing, that we don't see those gathering, but I do worry that it will still happen, and that's why the law enforcement and others will try their best to keep a close eye on all these activities.
Thank you.
Any further questions from CTV?
Yes, with the COVID-19 vaccine arriving in Ontario, have you received any details yet on when or how much, or when do you expect to hear more on with the rollout for Windsor-Essex?
So to our understanding, the vaccine will actually arrive in Canada either today or sometime this week. And through that, then it will be distributed to wherever it needs to go. We know Windsor-Essex is a priority, and I can tell you that we should have the vaccine in a week or two. So the timeline is really short. We are working with our hospital partners, namely the Windsor Regional Hospital, to finalize all those additional operational details. Some of the information that we have available, some of the information it's confidential, and we cannot share all those details. But I can say for sure that we'll have vaccine in the next couple of weeks maximum, and we are working to put together all those operational details that are necessary. So the moment it arrives, we will have our team ready, us and Windsor Regional, to start inoculating the high risk population that would be directed partly by the province and partly based on our local situation and the high risk people that we will identify in the region.
Great, thank you.
Any further questions from CBC?
Dr. Ahmed, I know you had mentioned that any order involving the closure of small businesses, that's really up to the province. That's not something that the health unit should, the fingers shouldn't be pointed blame towards the health unit. But, what would your message be to small business owners who say, if the virus isn't spreading in my business, why do I have to close my doors? And what are your thoughts on the province's directive that essentially shutters a number of small businesses around the region?
Well, I think when in an ideal situation, and again, I don't want my words to be taken out of context. In an ideal situation, everything should be closed, period. That's the ideal situation. But then we talk about what are some of the needs that we can think about that people will need to stay at home. Food and essentials are critical, even when you're in lockdown. That needs to happen. And any supplies for maintenance and anything, those are essentials that need to happen. And on top of that, you also need to think about the equity about people, that how they would access those food supplies and anything that they need. Those are the things that should stay open in a pandemic. And again, I'm not going back to what should or shouldn't happen. These are all the provincial framework, but I'm just talking strictly from a public health perspective. Those are the businesses, those are the things that should stay open. It doesn't matter to me, it doesn't matter to anyone, whether we're talking about these services being offered by large businesses or small businesses or multinational companies. Really, it doesn't matter. So for me, the message is, again, the essential businesses, the essential services, that and allowing opportunities to stay home most of the time, even for work from home. So all those messages are there, and as I said before, that those are not my criteria to compare and contrast, to say you are essential versus you are not essential, what you can sell, what you cannot sell. Those are not my area of expertise nor my jurisdiction. So I gave you just a broad overview of what the public health framework for these type of issues looks like. But again, at the end of the day, those are all some of those things that needs to be dealt with at a different level. And public health definitely do not have a lot of stake in it, but I do understand the concern that are brought forward by our local businesses, and truly get it that there may be a number of issues, but overall in pandemic, we have to use every opportunity to stay indoor and do not go outside to prevent the spread of the disease.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
Yes, Teresa, just to go back to what you were saying about looking at finding other resources to assist you, can you share yet who you're approaching to see if you can get additional help from them? Is it still the province, or is it an independent body?
So we continue to use the resources provided to us by the province, which are the contact tracers and also case investigators that are, there's some more that are, or there's 4 that are starting today. And then I've had some initial conversations with an outside agency, and until it actually becomes a reality, I'd rather just keep it confidential as we continue to work with them to see if they can assist. But I am pretty hopeful that they have what we need, and so we do have a meeting later on today to kind of further explore this, but this was a recent talk from last week, and we're just trying to move it along very quickly. So hopefully more information soon, but nothing that I feel comfortable sharing, before it's actually finalized.
Okay, and the 4 case managers, are those in addition to the, I think, 5 or 6 that you had spoken about previously?
No, these are the same group. So there were 4 that were starting, and I believe another 5 and then 4. So I think in all we're probably going to get 9 or 10, or whatever else the province is able to share with us, knowing that these resources are from a shared pool that are also distributed throughout the province to other areas in need as well.
Okay, thank you.
Thank you, everyone.